BCPS, the key steps to get started. So first of all, just a small introduction on what is BCPS. It stands for Board Certified Pharmacotherapy Specialist, and it's like doing a specialization in the pharmacotherapy. And this is a certification examination provided by the Board of Pharmacy Specialties in US. And it's like a specialization which you do after your PharmD graduation with a specific number of years in clinical practice. So why we get certified in certain specialty? It's considered as the gold standard, and it is kind of it measures the quality of the pharmacist. It gives you a certification telling that you have been qualified to work in this particular specialty, and it gives you an idea about how to do an advanced level of practice. It improves your patient care, and it will help you to know more about the recent advances, and it's an opportunity for you to refresh your basics. So there are multiple specialties for doing your certification, and the selection of this specialty depends on your interest, which area you want to work on, and which is your area of expertise, and what's your career goal. All these factors will help you in identifying the particular specialty for you to prepare. So these are the various specialties the Board of Pharmacy Specialty is giving certification for, and pharmacotherapy is one among them, which I cleared. So just before getting into the topic, key steps to get started for this examination, I would like you to know more about this exam. So it is divided into 3 domains, and as you can see, majority of... Yes?
Sorry to interrupt, but I was joined late, so can you please, in short, tell me which exam is this and in which country are we going to apply for this? Thank you.
Yeah, we are just talking about board certification in pharmacotherapy specialty, and we have just started. I just mentioned about the BPS, which is a Board of Pharmacy Specialty, and I was telling them pharmacotherapy is one specialty among them. So I just got into what is the content outline of this particular exam. So it contains 3 domains, which includes majority of the exam comes from the pharmacotherapy as such. So it includes the treatment part, the patient-centered pharmacotherapy, and the second domain is the 25% of the examination includes evidence-based medicine. So learning about the research methodologies, extracting the evidence what we have from the available literature, and then applying that evidence to our practice based on our clinical scenario. That includes the 25% of this exam. And then there is a small portion which includes the population health, where you have to know about the prevention, screening of some common disorders, and how to take care of the population as a whole. So in patient-centered pharmacotherapy, it's basically approaching the patient. So how you diagnose a case, what you get to know about the patient, and once you start the treatment, how you're going to monitor the patient, what kind of modifications you're going to do in their pharmacotherapy plan, and how you're going to communicate it with the patient. What's your plan? What you want to do? What's your expectation? And educating the patient regarding the expected outcomes, and if that is not achieved, what you're going to do. So this flow chart will be practically applied to each and every case based on their conditions and the available pharmacotherapy regimen. The second domain which we mentioned, the evidence-based practice or evidence-based medicine. So how to extract the evidence-based medicine data and how to assess the available data, and then how to apply it into our patient or our population. So utilizing the research data into the clinical scenario for providing a better patient care. And then the third domain is the healthcare system and population health, where I mentioned like how we are going to take care of the population by implementing safe strategies to improve the patient or the population health, and to utilize the all new technologies for safe and effective medication use, and bring in whatever data or whatever technologies available to improve the population health. So it's not about a single person, but as a population, what all steps you can take. For example, immunization to prevent further infections. These small steps to take care of a population and helping them to identify how economically they can go for a better pharmacotherapeutic regimen. So once you become a board certified pharmacist, a board certified pharmacotherapy specialist to be specific, your role is going to be optimization of the pharmacologic as well as the non-pharmacologic therapy. So in short, you need to know about the medications as well as non-medical treatment. For example, physiotherapy or the rehabilitation, and what other methods you can use, like lifestyle modifications and diet restrictions, which can be included in your treatment regimen, and how you can tailor each and every treatment for a specific patient based on their clinical condition. And working as a healthcare professional, you need to be involved yourself with other healthcare members also. So how to interact among them, how to communicate with them, how to educate them regarding the pharmacotherapy, and have a better collaboration with the whole team. You're not going to work as a single person, but how to interact with your staff, the nurses, the physician, or other physiotherapists, or the dietitians, whoever is part of the patient care. You need to have a good rapport with them also. And what is the impact of this certification? It's going to improve the quality of care we are providing. It will give you a new perspective towards approaching the patient, and it helps you to be unique, because not all are having this board certification. And once you complete your graduation with a good number of clinical experience, after choosing a particular specialty, if you get board certified, it means that you have been qualified to practice as that particular specialty pharmacist. And it's like a recognition in that particular specialty. So coming to the main point, what are the key steps to get started? So just knowing about the exam, now you should understand each and every question of this exam is like you're standing in front of a patient. So when you see a patient, you need to know the A to Z details of that case, starting from the demographic details, entering into their medical condition, what all past medical history they had, what all medications they have been exposed to, what all consequences they faced during their treatment, were they given appropriate treatment or not, so what all difficulties the patient had, looking into the socio-economic status of that patient, and identifying the best treatment for that patient. That's what you're going to do for each and every case. That same thing is going to be assessed in this particular certification exam also. So if you are planning to take this exam, even before you become eligible for this exam, even when you're doing your Pharm D or just after you complete your Pharm D, you can start your preparation. How to do it? My best suggestion is to start with your patient. Each and every patient is going to help you learn a lot. Start from the basics. So if you're trying to practice clinically, you need to start with your patient. It starts with communicating with your patient. Get to know more about their medical condition, what is their suffering, the severity of the issue. So you need to apply some scales or some assessment, a quantification has to be done. So what are the available uh, methods or the assessment, or what are the scorings which is available for assessing your patient's condition. So knowing more about the medical diagnosis, understanding the disease is the first step. And assessing the disease severity will help you know how difficult the patient is, or how difficult it is for the patient. Uh, addressing For addressing the condition, you need to know the severity, and based on the severity only, you'll be choosing the medication for that patient. So once you know the diagnosis, you need to know what are all the available treatment. From that treatment regimen or the available medications, you need to choose the best for the patient. So from the diagnosis to the medication, and from the group of medications, you need to choose one particular medicine for that particular patient. So what is the diagnosis? And coming to the treatment part. So this is something which you can start with from assessing a patient. And from there, to move on, you need to have good theoretical knowledge. So how to improve your theoretical knowledge? You can just start from the common diseases like diabetes, hypertension, renal impairment, or some common diseases like the cardiology conditions, including myocardial infarction or the ischemic heart disease, atrial fibrillation, or other neurological emergencies and cardiology emergencies. These are also common topics you can start with. The majority of the cases which you see during your ward rounds is the best way to start or improve your clinical knowledge. So whatever you have learned in your Form D, that is the pathophysiology. You should know what is happening when a patient has a disease. What all are the changes in the physiology which is happening inside the body, and what is creating the complication, which part of the body is affected, and what kind of variations in the normal physiology happens. So understanding the pathophysiology is the first step, which will help you understand the pharmacotherapy. So for understanding pharmacotherapy, you need to know the pharmacology of that particular class or that group of medication. So you need to be very thorough with the pathophysiology as well as the pharmacology of the medication. Only if you have good or sound knowledge in these two areas, you will be able to apply the pharmacotherapy, or you'll be able to understand the pharmacotherapy in a better way. Once you know more about the disease as well as the available options, the guidelines or the recommendations will help you choose the medication. For example, if a patient is coming with a diabetes, he may be a newly diagnosed patient, he may be a non-case of diabetes. He must have been given treatment by different doctors. He must have been tried on various medication. Maybe the patient has suffered some major side effect or some adverse events to the medication. They may not have given good response to the medication which you have chosen. So assessing the previous history, medical as well as the medication history, will give you an idea about the patient's condition as well as the response to each and every treatment. Based on that, you have to plan for your patient. What drug has to be chosen next? Should you give it in a combination, or should we go for a monotherapy? Should we go for an oral treatment, or should we go for some parenteral administration? So the drug of choice based on the patient, comorbidities as well as the demographics. Especially you need to consider the socioeconomic status. So once you choose the drug, what are your treatment goals? Are you trying to bring down the blood sugar very fast, or do you want to make it a slow way? Do you want to do it in a slow way? So what are your treatment goals, and are you planning to achieve it very soon, or do you have some time like a 1 month or a 3 months time? So you need to communicate this to the patient. And what are the monitoring parameters that you're planning for that particular patient? For example, the blood glucose is going to be the one for diabetes patients, and once in 3 months you need to go for the HbA1c, or the so-called glycosylated hemoglobin. So when you have a plan for a patient, which you decided based on the guidelines and the recommendations, and you had a drug of choice, and based on the contraindications, you are just filtering out all the options, and you're planning a regimen for the patient, and then you start communicating or counseling with the patient. This is what I have planned, and there is a 3 month time for which, sorry, within this 3 month time, you're trying to achieve the goal. So once you educate the patient, they will know what to expect by this period of time. So I'll just take you through one case scenario. So we'll have this as an example. This is a 50-year-old male with a past medical history of diabetes mellitus. While going through the clinical examination, when you monitored his vitals, you came to know that his BP is around 150/100. And currently he is on metformin tablet 500 mg twice daily alone. So as a clinical pharmacist or as a pharmacotherapy specialist, what better you want to do for this patient? As a case of diabetes, you know this 150-100 BP is on the highest side. So as per the American Diabetes Association guidelines or recommendation, and as well as the hypertension guidelines, this patient's BP should be less than 140/80. So you're targeting a BP with a systole of with a reduction of 10 mmHg, and the diastole you need a 10 to 20 mmHg reduction. So how to plan the treatment for this particular patient? This is a very simple case. So you know the patient is having a high BP and there is a comorbidity of diabetes mellitus. As per the recommendation, the first line antihypertensives are calcium channel blocker, AC inhibitor or the ARBs, and thiazide diuretics. And you're trying to get a target BP of less than 140/80. So if you look into the potency, thiazide will give you a very good reduction in the BP, and CCB is not that bad, followed by ACE or ARB. So among this, if you want to choose, you can go for an AC inhibitor or an ARB. This is preferred because the patient is having a comorbidity of diabetes. This class of medication is going to have additional advantages with the diagnosis of diabetes. So once you get the class of medication from the guidelines, for example, you choose AC inhibitor, you have to look for the contraindications. For example, you have multiple drugs like ramipril, enalapril, captopril. So from this, you need to choose one specific AC inhibitor. And based on the patient's renal, hepatic, and previous medication history, just look into the part whether he has suffered some side effect or adverse reaction to the molecules which is similar to the AC inhibitor, or is there any other lab parameter which is going to cause a problem with AC inhibitor. In that case, you can go for an ARB. If again ARB is not indicated or it is contraindicated, we have to go for the next first line agent, which will be a calcium channel blocker. So I'm just trying to wind it up soon because I know we are running late. So I'll be happy to take some questions if you have any.
Yes, ma'am.
Sure,
Hello,
ma'am.
ma'am. One questions. Hello, ma'am. Dr. Ananta, ma'am. Hello.
Yes.
Hello.
Yes, I can hear you.
Ma'am, again open specialty slide. BCPS specialty course which is first 3 and 4 slide, ma'am. I think open again, ma'am.
Yeah, can you see my slide?
Yes, ma'am. Yes, ma'am. Thank you, ma'am.
So these are the specialties.
Ma'am, one. Yes, ma'am.
Yeah,
Hello,
please continue. Yeah.
ma'am. Formed PV students also eligible for BCPS.
Yes, you are eligible for the board certification exam once you complete the required clinical experience years.
Okay, ma'am. How much fees for form? How much fees in this
Okay,
form? BCPS form.
for application and appearing for this examination, the fees is $600 for the initial certification. And in case if you don't pass during your first attempt, then there is a 50% reduction. If you appear within 1 year time, you have to pay $300. So for the first attempt, it's going to be $600.
Okay. Okay, ma'am. Any ma'am books, especially book, ma'am, for reading?
Yeah, for preparing, there are no specific books actually. There are some online review materials which will help you prepare for this exam. So it is being provided by American College of Clinical Pharmacy, which is ACCP, and American Society of Health Pharmacists. I think that's the right abbreviation. It's ASHP. And then there are other
Is it?
organizations also which is providing the proprietary material like High Yield Med Review, HYMR, which is the one I used. And it was really helpful and informative. And then Met 101 is another site which helps you. So if you just Google, you'll get to know so many online proprietary materials. And the cost is also kind of variable for each and every organization. So based on how long you're planning to prepare and what's your budget, you can choose the one.
Okay. Ma'am,
Ma'am, how much experience is
American
required
Society for Pharmacists Association.
I'm sorry.
Okay, thank you, ma'am. Thank you.
Ma'am, can you hear me,
Yes.
ma'am?
Yes, yes.
Ma'am, I want to ask that in the young stages of PharmD, like first year, second year, third year, there are subjects like pharmacotherapeutics 1, 2, and 3. How to study at its basic level and what to study at the basic level of pharmacotherapeutics.
Okay, so for getting a good grip over the pharmacotherapy, you should have a sound knowledge about the pharmacology of these medications. So in pharmacotherapy, when you have a disease, they will help you understand which class of drug has to be chosen first. So like the example which I gave you, when it comes to hypertension, the pharmacotherapy approach will be go for the first line antihypertensive. And they'll tell you it is a calcium channel blocker, thiazide and AC or ARBs. So if they tell calcium channel blocker, you should be knowing what are the different classes of medications which come under calcium channel blocker, what are the different medicines, what are the pros and cons of each medication. If you take the calcium channel blocker, you know you have dihydropyridines and non-dihydropyridines. So not all CCBs are recommended as first line antihypertensive. So among the CCB, diltiazem and verapamil is not considered as first line. So if you look into the amlodipine, cilnidipine, all these CCBs will come under the first line. And among that, after going through the side effect profile, you need to choose the best medication for that patient. This is what you learn in pharmacotherapy. So after giving the first line
Hello, ma'am. Can you hear me?
Ma'am, I can't hear voice.
I am sorry, there was some network issue. Am I audible now?
Yes,
Yes.
ma'am.
Okay, so I was telling about choosing the medication. So even though you get to know what class of medication you have to give, you need to know what is the which is the exact drug you need for that particular patient. So for choosing the drug, for playing around with the drugs, you need to know the pharmacology of each and every medication. So if you ask me what pharmacology we should know for each and every medication, I will bring it down to know the mechanism, just the simple mechanism. I'm not asking you to memorize the CAM, the ATP, all those inhibition and escalation. I'm not asking you to do that, but at least if you can know this is a calcium channel blocker, if you can know this particular, for example, the furosemide comes under the loop diuretics, and what is the action of the loop diuretic? If you can know this much detail as part of the mechanism, get to know which medication is safe in renal, safe in hepatic, safe in pregnancy, safe in lactation. Or the other way, get to know whether this medication is contraindicated in renal impairment, contraindicated in hepatic impairment. It is not advisable in pregnancy. It is not advisable in lactation. If you can cover these many areas, at least. Mechanism, contraindication in renal, hepatic, pregnancy, and lactation. Along with this, you need to know the major side effects and some black box warning or the major contraindication. If you can know this much information from each class of medication, it will help you a lot to choose the medication out of the given options. So focus on the pharmacology part and understand it well so that you will know when to choose which medication for this particular condition and for this particular patient. All diabetes patients are not being treated with a single medication or the same medication. It is because of the individual variation we see and based on other comorbidities. So knowing or being thorough with the pharmacology of each and every class at least. If it's difficult for you to memorize for each and every drug, at least know some specific points in each class of medication so that it will be easy for you to apply it into the pharmacotherapy. I think that should be sufficient for you to know during your early stages of PharmD.
Thank you, ma'am.
Excuse me, ma'am.
Yeah.
After graduation, after 6th year, do we have to apply for NAPLEX or FGE exams before attending that BCPS? Or we can
Okay.
directly give that exam, BCPS exam?
See, NAPLEX is not required for BCPS. The advantage of BCPS is like even while you're working in India, you can apply for the BCPS and you can write this exam from India itself. So they have exam centers in each in various cities in our country. So you can choose it based on your convenience. That's one advantage. And second thing is like for NAPLEX, you need not show any clinical experience. After your PharmD, you can directly go to US. You can apply for the foreign pharmacy graduate equivalence exam. And once you pass that and do your internship, you will become eligible for the NAPLEX. For BCPS, once you finish your PharmD and get your license, you need to work or have clinical experience. That's what they prefer for 3 to 4 years. The number of clinical experience years depends on which specialty you are choosing. So it's not necessary that you need a NAPLEX for attending this BCPS exam if you are writing from India. From India, the only eligibility criteria or which is needed is your clinical experience. So you can both are going in a different path. NAPLEX is for US pharmacy license. That's a license exam for US pharmacist. And this is something like an additional specialization or an additional certification while you are practicing as a clinical pharmacist.
Thank you, ma'am.
Yeah, ma'am. Thank you, ma'am. Thank you, ma'am, for sharing your valuable time with us and insightful sessions. And thank you for joining SYCCON S3, ma'am. Thank you, ma'am.
Okay, thank you. Thank you for inviting me to this session. Thank you.
Welcome.
Once
Thank
again,
you,
thank you
ma'am.
so much, ma'am.
Thank you so much, ma'am.
Yes, thank you.
Thank you, ma'am.